Hello, everybody. Welcome to another webinar on Hogue Medicare Benefits. Excited that you're here, and I want to thank you beforehand just for taking the time to come and watch this educational format that we're going to provide. I'll let you know a little bit about what we're going to do. My name's Henry Liu. I'm here on behalf of Hogue Hospital, Hogue Medical Group, and Hogue Physician Partners, and this is the agenda for today. I'm going to share with you a little bit about Hogue Hospital. And then Jeanette Paterka is going to give you an overview of Medicare. And then the health plans that are here today are going to share with you a little bit about the health plan changes and some of the benefits that are for this year. So let's talk about Hogue. Hogue has two main hospital campuses that are located in Newport Beach and Irvine. We have 14 urgent cares, 9 health centers throughout the county. Hogue's medical staff includes more than 1,700 physicians, represents 52 different specialties. We have 5 specialized institutes of excellence: neurosciences, cancer, heart and vascular, women's, and orthopedics. About Hogue. Hogue is designated as a magnet hospital as part of the American Nurses Credentialing Centers, the ANNCC Magnet Recognition Program. Hogue is the highest ranked hospital in Orange County by U.S. News and World Report for 2021 and 2022. Hogue in your community, our Hogue Health Centers. Hogue is committed to providing health care services in the communities we serve through our Hogue Health Centers. We are located in Aliso Viejo, Costa Mesa, Foothill Ranch, Huntington Beach, Irvine and Sand Canyon, Irvine and Woodbridge, Irvine and Woodbury, Newport Beach, and Tustin Legacy. Our urgent care centers. We have urgent care centers that provide care 7 days a week for the unexpected illnesses and injuries. We are located in Aliso Viejo, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine and Los Olivos, Irvine and Orchard Hills, Irvine and Sand Canyon, Irvine and Woodbridge, Irvine and Woodbury, Newport Beach, Newport Coast, Tustin Legacy, and Tustin Ranch. And we also have a Hogue Flywell Clinic now open at the John Wayne Airport, Terminal B, and it is pre-security. Access to primary care. How do you get to see our primary care doctors? To see a primary care doctor at Hogue Medical Group or Hogue Physician Partners, also known as HPP. Hogue Medical Group. We have primary, urgent care, and specialty physicians. We have over 100 physicians, 21 primary care locations, 13 urgent care locations. And if you want more information, go to hoguemedicalgroup.com. Hogue Physician Partners, or HPP. We have 10 primary care physicians. We have over 350 specialists in service managed care patients that provide service to managed care patients. If you want more information, go to hoguehealth.org/HPP. Here's a little more information on Hogue Medical Group. Once again, we have over 100 physicians, family medicine, internal medicine, pediatrics, geriatrics, sports medicine, allergy, immunology, endocrinology and diabetes, rheumatology, HIV medicine, infectious disease, and palliative medicine. We're located in Aliso Viejo, Costa Mesa, Fountain Valley, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Laguna Beach, Newport Beach, San Clemente, and Tustin Legacy. Some of the features of our medical group is that you can get same-day sick appointments if you're an established patient, and we accept most major HMO, PPO, and Medicare insurance plans. We really pride ourselves on unrushed and personalized visits. Hogue Physician Partners is an independent physician association. We have 10 primary care physicians, over 350 specialist physicians representing over 50 specialties. Our recent additions include Orange Coast Women's Medical Group, where we have over 20 OBGYN physicians in 6 locations, providing an integrated care model for women as they move through the stages of their lives. We have Hogue Gynecologic Oncology, Hogue Urologic Oncology. We have access to the Hogue Network, including Hogue Health Centers and Hogue Urgent Care. And customer service line is 800 369-9247. Now I'd like to introduce you to Jeanette Paterka, who's going to give you and provide you with an overview of Medicare.
Good afternoon. My name is Jeanette Paterka. I am a licensed insurance agent, and I am here to discuss and talk about Original Medicare today. So the senior insurance plans accepted listed on this slide are the Medicare Advantage. Sometimes you'll hear MAPD. That means Medicare Advantage with prescription drug coverage. So it includes the medical and the drug coverage. These are the ones accepted by Hoag Hospital and Hoag Medical Group. This is a picture of your new Medicare card, of the new Medicare card. The difference of this card, Medicare issued a new standardized card a couple years ago, and the main difference is the Medicare number. The Medicare number, as you see here, is an alphanumeric number. This is your Medicare identification number, and this number used to be a Social Security number. It could have been your Social Security, or if you had a spouse that paid into the Medicare system and you're drawing your benefits from that spouse, it would have been their Social Security. But now we have a new alphanumeric number. When you enroll into a Medicare health and or drug plan, you will need this card. You'll need to transcribe the information exactly from this card onto your enrollment form. If there's anything that is missing or incorrect, it could pend and possibly delay your application. Take note at the bottom, Hospital Part A and Medical Part B, these are the effective dates for your two parts of Medicare, and we'll discuss what those are. So what is Medicare? It's health insurance for the following people: individuals that are 65 and older. If you're under 65 with certain disabilities, you have to be deemed disabled with the Social Security Administration. If you have end-stage renal disease, what that means is that you're actually on kidney dialysis, or if you have Lou Gehrig's disease. And there's also different parts of Medicare. So Part A, this is the Part A and B. Those are Original Medicare. Those are the parts I discussed from your Medicare card. So Part A covers hospital, skilled nursing, hospice services. It could include also outpatient surgical centers. I like to think of it as the facility portion of your benefits. And then Part B covers the actual services that you receive. So doctor's visits, outpatient care, lab, it could be occupational therapy. So that's the services that you receive. So Parts A and B encompass Original Medicare. And then Part C. So Medicare Advantage plans are offered by private insurance companies approved by Medicare. So the plans that you're going to hear, the insurance companies that will be speaking and going through their benefits today, those are Part C plans. What you need to remember is I've known individuals that have said, you know, I don't want to sign away my Medicare. But what happens if you enroll into a Medicare Part C plan? You're simply telling Medicare, instead of the Medicare administration, the federal program, instead of them administering my benefits, I would like one of these independent contracted insurance companies to offer to provide my benefits for me. And then Part D of Medicare, in 2006, Medicare added Part D to the benefit package, and this is a plan that must be purchased separately. It needs to be paired along with Original Medicare, or if you have a Medicare supplement or Medigap plan, and then you need to add a Part D plan. So there's different parts of Medicare, and there's different ways to obtain your Medicare benefits. So for Part A, most people that work and pay into the system, and they have a deduction on their payroll, a Medicare deduction, and that pay into the system for 10 years or a total of 40 quarters in your working career, there will be no cost for Part A of Medicare. Part B of Medicare, all beneficiaries must pay their Part B premium. So that Part B, which is the services you receive, it's dependent upon your income. And so we're going to go through the grid in just a moment, but all individuals must pay a Part B premium when they activate or begin using their Medicare benefits. And then Part C of Medicare, those are the contracted private insurance companies. Those plans can go, as you're going to hear, from a zero premium all the way up over to $100 premium per month. And if your Part C plan has a premium, you must pay this premium in addition to your Part B premium as well. And then Part D plans, we mentioned those just a moment ago. Those are the individual plans that you can pair with original Medicare and a Medicare supplement. Those plans do have a premium, and they're offered by private insurance companies. So in 2022, the Part B income-based premium, if you take a look at the second section there, $91,000 or less, that is for an individual, and $182,000 or less, that's for a married couple, and this is filing jointly. This is the adjusted gross income. So if you fall into those brackets, either under $91,000 or $182,000, each individual on Medicare is going to pay $170.10 for their Part B premium. This money is paid via your Social Security, so I like to call it the Social Security Award. So the money that Social Security deposits into your account, they will deduct this Part B premium and then deposit the balance. Now, if you are still working or you're an individual that wants to delay their Part B or their Medicare benefits, you can go ahead and they will send you a quarterly statement, and they will bill your Part B premium via quarterly statement. You need to mail that in. And as you can see, looking at the grid, it is adjusted by by an individual or a couple's income, and it goes all the way down to the very bottom line. If an individual has an adjusted gross income of $500,000 or greater, or $750,000 or greater, then each individual is going to pay $578.30 for their Part B. And then potentially there could also be a Part D income-based premium. So if you take a look at that top line, $91,000 or less or $182,000 or less, if you fall in that initial bracket, there is no additional premium. But for individuals that have a higher income, individuals and married couples, as you can see, there's an additional premium for Part D as well. So we're going to talk about enrollment periods. So the enrollment period right here, this is for an individual that's new to Medicare. So what we're talking about is an individual that is going to opt into using their Medicare benefits when they turn 65, when they're initially eligible. So you have a 7-month window to enroll for Medicare. You can contact Social Security, or what you want to do is contact Social Security 3 months prior to the month of your birth date. So as you can see there in month 4, right in the middle, if that's your birth date, you have 3 months prior, contact Social Security, let them know you want to begin your Medicare benefits. They will go ahead and send you a Medicare card and then start billing starting month number 4 in this illustration, your Part B premium. And then if you're if you enroll in that 90 days prior, your Medicare is going to begin the first of the month of your birth month. And then if you enroll in Medicare, say in months 4 or 5, 6, one of those later months, then you need to go ahead and just take a look at the card that they issue you, and it will have the effective dates on it. So the next enrollment period is the one that we're actually right in the middle of right now. It's the annual election period. This is the time when individuals that are on a Medicare Advantage plan or a Medicare drug plan need to take a look at the plan that they're currently on for, so say in this example in 2021, the plan you're on, and then you want to determine if that's the plan that you want to remain on for the year 2022. And during this time, you can change or enroll in a prescription drug plan. You can change your Medicare Advantage plan. You can return to original Medicare, or you can enroll in a Medicare Advantage plan. This is the time of the year where you need to be your best advocate for yourself, and you need to take a look and determine if you need to make a change. The applications need to be submitted between October 15th, and the deadline is December 7th. So we are coming up on that deadline very quickly next week. If you are considering making a change to your plan, I would contact probably today, sooner than later, one of the representatives that's going to speak, and they can give you information because they tend to have their schedules very impacted as we get closer to December 7th. So that is the time that you can make the change. You have to submit that application by December 7th, and then it's effective on January 1st. Then the next enrollment period is the open enrollment period, and that's January 1st to March 31st. So if you're on a Medicare Advantage plan, you have one additional opportunity to make a change. So you can switch to a different Medicare Advantage plan, you can drop your Medicare Advantage plan and return to original Medicare, that's Parts A and B, and then you can also enroll in a Part D plan. The timing on this, so say if you submitted an application on February 15th, it's going to be effective the first of the following month. So if you submit an application, say on March 20th, it's going to be effective on April 1st. And then you're going to be in what they call the lock-in period. You're going to remain on that plan from April 1st to December 31st. And then the whole process starts over again the following year. Medicare does, though, for special circumstances, they allow changes mid-year during that lock-in period. Some of the most common ones are if you're moving from one service area to another. So Medicare Advantage plans are based by county. So if you're on a plan, say here in Orange County, and you move to San Diego, you will need to enroll mid-year on a plan that is based in San Diego County. Also, you can enroll mid-year into Medicare Special Needs plans. Many of the companies have plans that they call chronic plans, and what that is if you have a chronic condition. Some of the most common ones are, say, if you have heart failure, congestive heart failure, or if you have diabetes, you can enroll mid-year into one of these plans. The benefit for that is that those plans are designed specifically for individuals that have those chronic conditions. So they might have additional prescriptions that are covered or additional benefits specific to your condition. And then individuals that are full dual beneficiaries. What that means is you have Medicare, that's the federal program, and Medi-Cal, which is the state low-income program. If you fall into this category, you can switch year-round, or LIS, which is Low Income Subsidy. That's a program that is offered through Social Security, and I'm going to go ahead and in a few slides I will go into a little more depth of that. But these are some of the reasons that you can move mid-year during that lock-in period. So prescription drug coverage. What I'm going to walk you through today is the baseline. So all of these companies that are going to talk today, they have to offer at least the baseline of what Medicare requires or better. So this is the baseline. Many of the benefits you're going to hear today are going to be enhanced over this, but the baseline for Medicare prescription drugs is that at the beginning of the year, you're going to have a $480 deductible. So say you go into the pharmacy and you have a few prescriptions, and the first month in January, maybe they add up to $300. So you're going to pay that first $300, and then in February when you go back, you're going to pay the additional $180. So then your deductible will be satisfied. So that's the initial coverage limit, the deductible. And then you go into a new phase, which is the initial coverage limit. And that is after the deductible is paid. It is the combined amount of the cost of your medications that you pay and what your insurance company pays. So in this example, if you have a $25 prescription and you have a $5 copayment, your insurance company pays the balance, which is $20. So that $25 is deducted from the initial coverage limit of the $44.30. So you are going to pay copays, and your insurance company covers the balance of the cost up until the total amount equals $4,430, and then you enter another phase, which is called the coverage gap or the donut hole. So this is a temporary change again to the way you pay for your prescriptions. So once you reach between $4,430 and then reaching the catastrophic, which I'll go over in a moment, you're going to pay 25% for your generics and 25% for your name brand medications. And then Once you reach the catastrophic limit, which is $7,050 in the calendar year, you're going to pay $395 for your generics or 5%, and $985 or 5% for all other drugs, whichever is less. So I mentioned earlier, low income subsidy. This is a program offered, I would suggest, if you're on a lower or a fixed income, maybe you don't qualify for Medi-Cal, which is the state program, but you are on a fixed income. I would suggest going to the SSA website, Social Security Administration, and you will see a link that says LIS or Extra Help. I would click on that link and take a look at what the guidelines are for income. Even if you think you're a little bit above what they state, I would definitely suggest that you fill out an application. It's a very quick process. They may not include all of the income that you're thinking that they may include. If you qualify, it's going to help pay for your prescription drugs. So if you qualify, your generics are going to be $0 to $395, and your name brand medications are going to be $0 to $985. And then we have here the Medigap comparison table. It's used interchangeably with the term Medicare Supplement or MedSup. What this is, these are standardized plans that are designed to fill in the gaps that original Medicare, the gaps in coverage that original Medicare has. So Part A and B of Medicare, those do not cover all of the benefits. They definitely have gaps. And so you can purchase a standalone policy, a Medigap or a Medicare supplement plan, to fill in those gaps. The way that it works is, if you take a look at this grid, if you take a look at Plan N, take a look at Plan N on the right. So what you want to remember is that Plan N with Blue Shield of California or United Healthcare or Mutual of Omaha, a Plan N, like I said, the benefits are standard for all of them. But in this example, what you want to take a look at is the differences can be in the cost. So each company, insurance company, can have a different monthly premium for a Plan N. And you want to take a look at the reputation of the company. You want to make sure you're working with a reputable company. But if you enroll in one of these plans, like I said, they are standardized. So it will cover a Plan N with any of the companies will cover the exact same set of benefits. And then if you focus all the way to the right, Plans C and F are only available if your Medicare eligibility date was prior to 2020. From time to time, usually about maybe every 8 to 12 years, Medicare sometimes comes in and rearranges or resets up their standard plans. If you're on one of the current plans and you continue to pay your premium, your plan will never change. But what this is referring to on the right is we did recently have a change, and Plans C and F are not available to certain individuals. But as an example, if you are turned 65 in 2018, but you didn't opt into your Medicare benefits because you're maybe covered under your plan, if you're employed and you have employer coverage, or if you have a spouse that has coverage that you are covered under, you don't have to necessarily opt into your Medicare when you turn 65. But the fact that you were eligible to go into Medicare, you could have gone into it prior to 2020, means that at the time you decide to opt into Medicare, you are able to elect a Plan C and F if you decide to do so. So with that, we are going to have some of the insurance representatives come in and review the benefits. As I mentioned, these plans are all contracted with Hoag Hospital and Hoag Medical Group. We have a slight Thank you. And I am going to now introduce Mr. Michael Roberts with Anthem Blue Cross, and he's going to go through their lead plan for the year 2022. Thank you very much.
All right, ready to go? All right, so hello from Anthem Blue Cross. Michael Roberts here. I'm a regional sales manager at Anthem. Be glad to put you guys in touch with experienced and knowledgeable agents. Today we wanted to go over our MediBlue Select plan real quick. So just to run through the benefits, I understand that you guys have a grid that you're filling out. So I'm just going to rattle these off, take notes, and then I want to mention some of the aspects of Anthem's plans that I really think set us apart, and this should be interesting to you. So first of all, our star rating, right now we're at a 3.5. We do expect that to continue to rise. The premium for the MediBlue Select plan, again, that's our lead plan here with Hoag, is 0. Your office visits with primary care physicians and specialists, also 0. The max out of pocket, only $900. Hospital copays, 0. Emergency room copay is $90. Ambulance copay is $200. I want to point out that's for both ground and air. So regardless of which mode of transportation, I know some plans you'll have to pay like a 20% coinsurance for air, but again with Anthem, $200. Outpatient surgery, 0. Skilled nursing facility for days 1 to 20, it's 0, and then days 21 to 100, it's $75 a day. For x-rays and labs, MRIs, CT scans, diagnostics, it's all 0 copay. For physical therapy, 0 copay. Urgent care, 0 copay. And then if we're talking about our medications, so your tier 1 drugs, pretty much across the board is going to be 0 copay. Tier 2, if you go to one of our preferred pharmacies, it's a $5 copay. But if you use our mail order service, that is 0 copay as well. Tier 3, $42. That's a 30-day cost. Tier 4, $95. And then Tier 5, 33%. Tier 6 is select care drugs. Again, that's 0 copay. As far as the additional benefits included in the plan, dental. So put an asterisk by this, but what's embedded in the plan is it's really basic dental. So you're going to get preventive, 2 cleanings, you're going to get an x-ray, you're going to check up twice a year at 0 copay. But when we talk about some of our extra benefits, there is some options for additional coverage there that I think will really be attractive. Hearing aids. We have one of the best allowances in the business. It's a $3,000 per year hearing allowance. We work with a vendor called Hearing Care Solutions. You'll get a 0 copay exam. You schedule an appointment with one of their audiologists, and then if a hearing aid is recommended, you have a $3,000 allowance to choose from the different technology tiers of hearing aids they have available. Vision, again, put an asterisk by it, but what's embedded in the plan is a $150 allowance. You get the 0 copay exam, and so on. Health club membership. Anthem offers silver sneakers. Again, that gives you access to a lot of different gyms. You could go to 24-hour fitness in the morning or at midnight. You could go to the YMCA at noon, and you could go to LA Fitness in the evening. Lots of different gyms in there. Transportation, again, embedded, 12 rides, but put an asterisk by that, and I'll explain why. So we have what are called essential extra benefits. So what I just went through, we went through the plan costs. We talked about the max out of pocket. We talked about the copays for health services, drug copays, that kind of thing. We talked about many of the embedded benefits, such as hearing, vision, dental, etc. But again, what really sets Anthem apart, I think, is that we have introduced a category of benefits that we call the essential extras. And what that is a menu of 9 benefits from which, at least for this plan, you get to pick 2. So what are those benefits? A lot of great stuff in there. And I'll just start explaining them. The first benefit, we have an assistive devices allowance. So if you want to pick one of those 2 out of 9 benefits, your 2 choices, this is one of them, that is $500 a year for you to spend on items such as shower chairs, shower handles, This has been a really popular benefit. We've introduced it in other states because it offers some really good quality air filters. So there's some HEPA air filters, over $200 value in there. Again, you get a $500 allowance to choose some of those things. Pest control. So we work with Terminix, and at the very least, we will send out a Terminix exterminator quarterly, 4 times a year, to do preventive treatments. If it's bad enough, and if your doctor kind of confirms to us that you need it, then we could even do a whole home fumigation. Last time I checked, that's about a $5,000 cost. Transportation. You remember back when we were going through the basics of the plan, I told you several of these things. Remember, put an asterisk by it. Transportation was one of those. Embedded in the MediBlue Select plan, you get 12 rides. However, as one of these essential extra options, you can choose 60 additional rides. So if you need more rides than what's included in the plan already, that's one of your choices. You can get 60 more rides. Another benefit you could choose, in-home support. So this benefit is really meant to address the issues of isolation, social isolation, or loneliness, right? So Anthem works with a company called Papas, and they have representatives called PALs. The PALs will come out to your house up to 60 hours per year. Really, the idea is just, hey, to give you to somebody to talk to, hang out with. If you want to spend time watching a Netflix series and have fun doing that, great. But they'll also help you with some light tasks like maybe sorting medications, figuring out how to send some emails, paying some bills, grabbing something off a top shelf, that kind of thing. On the other hand, we have another benefit that is more medically oriented. If you're familiar with the term ADL, or activities of daily living, that's where people need assistance with basics like walking or dressing or eating. And if your doctor tells us that you need help with 2 or more of those ADLs, then up to 124 hours a year, we'll send out a personal home helper. That's somebody that really will, again, help you more with more medically oriented tasks that will help you with those ADLs. Okay. Let's see. A couple of meal benefits that we have. So if you need food, right, we have 2 options. One is a prescribed meals, healthy meals, where if your doctor tells us you need it, we'll feed you up to 90 days, 2 meals a day. We'll deliver those to you. On the other hand, if you'd like healthy groceries, we have an option in these essential extra benefits where you get $50 a month. We're contracted with a lot of major grocery stores around Southern California. Names you'll recognize: Ralph's, Albertson, Save-On, Vons, even Walmart, and I think CVS, where again, you get this $50 allowance per month, and that's for real food items. Sorry, we're not going to cover alcohol or candy or dog food, but on the other hand, real things that keep you alive like steak and shrimp, we will help you pay for that. Another benefit that I think is going to be really popular out of these 9 is what we're calling the Flex Card. So remember when we talked about hearing, dental, and vision, I said put an asterisk by those embedded benefits, because not only do you get the $3,000 annual allowance to spend towards hearing aids or the $150 for vision services, this is a $500 MasterCard debit card that you can use really at any recognized vendor for those 3 types of services: hearing, dental, and vision. The great thing about it, there's no network. You can allocate that money however you see fit. The only limitation on it is that you can't use it for cosmetic services. Let's see, I believe there's one more. I'm looking at my fine print here trying to read that one. I think I'll leave it at that. I think we've covered the main points, but again, what I think out of these essential extras is going to be really popular is going to be the Flex Card, the $500 allowance for hearing, dental, and vision, and then the healthy groceries. Those food prices are continuing to go up, so $50 a month that will help you spend on that. If you have any questions, please feel free to reach out to me. I believe you guys have my number. I'd be glad to put you in touch with any of very credible and knowledgeable agents around Southern California. Thank you.
Good afternoon, everyone. My name is Diana No, and I am an independent licensed broker and will be representing Blue Shield of California today. My contact information is listed in the chat box, but for the folks not streaming in live, my telephone number is 949-226-4064. A little bit about Blue Shield. They are a not-for-profit company based here in California. They've been in the healthcare industry for over 80 years. They offer a variety of products such as a Medicare Advantage plan, Medicare supplement, as well as prescription drug plan. So what does that mean for you? They are a one-stop shop. They'll have a product and a plan that best fits your need and lifestyle. Blue Shield offers a variety of Medicare Advantage plans, but for today's session, I will be reviewing the Inspire Benefits. So this is their leading plan in Orange County. So in the presentation, you may have seen a copy, is the comparison worksheet. So I'll be going down the benefits on that worksheet. But what's projected on the screen is a quick highlight of the benefits, all right? As I mentioned, I am going over the Blue Shield Inspire for Orange County. This plan is a 4-star rated plan. There is no premium for this plan besides what you pay to your Medicare, right? So you pay your Medicare Part B premium, you join this Blue Shield Inspire plan, it's a 0 premium. For your doctors, your specialists, primary care, also 0. This plan has a maximum out-of-pocket of $7.99. This is the most you'll pay out-of-pocket for your medical expenses for the year. And I'll be going over some co-payments that will go towards this maximum out-of-pocket. So for example, if you land in the hospital, it's a 0 copay. For the emergency room, let's say they patch you up, send you home, it's an $85 copayment for the emergency room. However, if you are admitted into the hospital, then that copayment is waived. This plan also includes worldwide coverage. What does that mean? So if you're traveling outside the United States, internationally, domestically, you are covered for emergency and urgent care services. And once again, it's an $85 copay if it's international or outside of Orange County. As for the ambulance, it's $100 per trip. If you need outpatient surgery, like the not-so-fun colonoscopy, your cataract surgery, it's a 0 copay for the ambulatory surgical center. However, if your doctor finds that you may be a high-risk individual and they might say, you know what, you need to have your procedure at a hospital. For that, it will be a $150 copayment for the outpatient hospital facility. But if it's off-site ambulatory surgical center, then it's 0. Skilled nursing. So let's say you had a procedure done, maybe a hip surgery or shoulder surgery. You're well enough to be discharged from the hospital, but not well enough to go home quite yet. You may be discharged to what's called skilled nursing or nursing home rehab services, right? So the first 20 days in skilled nursing, it's a 0 copay. If you end up staying there from days 21 through 100, it's a $50 copayment per day. So you might be asking yourself, hey, Diana, what if I end up staying in the facility for up to 100 days? Am I subjected to that $5,000 copayment? The answer is yes and no. You are subjected to up to the maximum out-of-pocket, which is $799. Once you pay the $799, you stop paying for your medical expenses, co-payments, etc. All right? The next few items, a lot of zeros. So your x-rays, your labs, your MRI, CT, PET scans, diagnostic testing, if you need physical therapy, speech, occupational therapy, as well as urgent care. It is all 0. You don't pay anything for those services. Moving along to prescription drug coverage, Blue Shield has a very robust formulary, so list of medications covered. So I'll be giving you the co-payments for the 30-day supply as well as 90-day supply for the preferred pharmacy. So you can have your medications filled via mail order, or you can go to like CVS, Costco, Walmart, Save-Ons, Albertsons, etc. So preferred pharmacy rates. So for Tier 1, it's a 0 copayment for both 30-day as well as 90-day supply. For Tier 2, you're looking at $3 and $4.50. Tier 3, these are typically your brand name medications. You are looking at $35 and $87.50. Tier 4 is $95 and $237.50. And lastly, Tier 5. This is typically your specialty medications, right? Injectables, chemotherapy-related type of pills that you fill at the pharmacy. You are responsible for a 33% coinsurance. This plan does not have a Tier 6. This plan also includes dental coverage. So you have basic dental coverage for Blue Shield. However, there is an option to upgrade for a PPO dental plan if you prefer to have your own dentist that you want to go to. As for hearing aids, this plan also includes it. So your hearing exam is 0, but let's say it's determined that you need a hearing aid. This plan covers 2 hearing aids. We have the silver technology for $4.99 per ear, or the gold technology for $6.99 per ear. And the vendor for the hearing aids is through a company called Epic Hearing. As for your vision coverage, so this is for your glasses, frames, your refractions, it is also covered at a zero copay. So for your annual exam, it's zero. If you need frames or contact lenses, you have a $200 allowance towards your frames or contact lenses. And the vendor for this is through VSP. So you may have heard VSP when you were working. So they are contracted with many of the optometry groups like Lens Crafters, America's Best, as well as private optometrists in the area. This plan also includes health club membership, right? So you may have heard of Silver Sneakers. They are contracted with many of the local gyms like 24 Hour Fitness, YMCA, LA Fitness. You can belong to any of those gyms and even all of them on the Silver Sneakers program. So as long as you're on the Blue Shield plan with Silver Sneakers, you have access to all those gyms and you can belong to more than one of those gyms. Transportation is also included, so you get 32 one-way trips. So if you need a ride to the doctor's office, urgent care, lab, etc., it is included on this plan. Now moving on to the extras. So this plan also includes over-the-counter, right? So these are items that you can order or call in depending on your preference. You can get items like cough drops, eye drops, ibuprofen, vitamins, cotton swabs, hand sanitizers. There's hundreds of items you can order, and you get $100 each quarter to order. Sincerest apologies, folks. We had some technical difficulties, but I am back. Where I left off, I was talking about the personal emergency response system. So in the past, you may have seen a commercial that says, "Help, I've fallen, I can't get up." So that's the device I'm referring to, so a medical alert device. It is through a company called LifeStation, and depending on your lifestyle, activity level, you can either get the traditional pendants, bracelets, or the GPS mobile device, all right? This plan also includes acupuncture and chiropractic services. So if you like to have some adjustments, it is also included. You get 24 visits at a zero copay for each service. So you get 24 acupuncture as well as 24 chiropractic visits at a zero copay. The network we use is called American Specialty Health. And lastly, regarding this plan, something new that Blue Shield has offered, home-delivered meals. Let's say you were discharged from the hospital, you're not well enough to come back home and meal prep. This plan also includes home-delivered meals at no cost to you, post-discharge from the hospital or skilled nursing. You receive 22 meals and 10 snacks per discharge, all right? So as I mentioned earlier, Blue Shield offers Medicare supplement plans as well. They have a very competitive premium for their Plan G as well as their G Extra. And I also want to mention, Blue Shield had recently announced what's called an underwriting holiday. What does that mean to you? So my folks that are currently on a Medicare supplement plan or maybe with a Medicare Advantage plan, not with Blue Shield, any company, any Medicare supplement company and Medicare Advantage company, if you're interested in hopping onto Blue Shield's Medicare supplement policy because they have extremely competitive rates, or because you haven't had the chance to maybe pass the underwriting, etc., they're offering what's called an underwriting holiday, meaning you can hop onto Blue Shield's Medicare supplement with no questions asked. Okay, no questions asked. Hop on, give me a call. So lastly, don't forget, the annual enrollment period ends in 6 days. So if you want more information on the Medicare Advantage plan, Medicare supplement plans, as well as prescription drug plans, you're welcome to give me a call. Once again, my number is 949-226-4064. So I'm going to go ahead and introduce my next colleague. Unfortunately, Scan wasn't able to come today, but I will move on to United Healthcare with Rosalie. Thank you so much for your time, and have a happy holiday.
Okay. Tell me when. Oh, hi, I'm Rosalie Puglia with AARP Medicare Solutions with United Healthcare, and thanks so much for being here this afternoon. We really appreciate your time. I'm going to go over the benefits for the Medicare Advantage plan called Focus with United Healthcare, and a little bit about United. They are a Fortune 5 company, and they have most of the Medicare Advantage plans in Orange County, so that's pretty terrific. Just a little note, too. Again, my name is Rosalie Puglia, but my telephone number is 714-292-3796, and that's my personal cell, so you can give me a call if you would like to learn more or get enrolled. Okay, so let's go over the benefits. For United Healthcare, the star rating this year is 4.0, and that's been consistent over the last couple of years. And the premium is zero, no premium. The copays for physician. What? Oh, I'm supposed to. Oh, sorry. Is that it? Mm-mm. It's not moving. Ah, there we go. Now they have the benefits up there. Okay, great. So let's go over that again. So all of the specialist visits, the primary care as well, that is going to be zero copay. Now, some of the things that I'm going to go over today are just some additional things that happened this year that they made their benefits better and decreased in some of the costs. So that's really a good thing as well. So here's one of the things that were decreased in costs, and that is maximum out of pocket is $800 for the year. That's $200 down from last year. And then hospital copay is going to be zero as well for unlimited amount of days. And emergency room is going to be $90 if you're released from the emergency room. But if you're admitted, that $90 is waived, and so you wouldn't have to pay anything. It goes into your hospital benefit. And then ambulance, here's another benefit that cost that was reduced. The ambulance is $130 for each ride, and I always tell my clients to check with their city to see if they have a paramedic program, because the paramedic program is $5 a month, and it's attached to your water bill, and then you don't have to pay the ambulance fee. And let's see. So then the outpatient surgery, whether it's in the hospital or in a separate facility, it's going to be zero copay, which is great. And then we have the skilled nursing. Skilled nursing, its first 20 days is free, or zero copay. And then days 21 through 28, it's $100 a day, up to the $800. Okay. And then days 29 through 100 is going to be zero copay again. For your labs and x-rays, it's zero copay. And now here's an additional benefit that just dropped this year. MRI CT scans are zero copay. Diagnostic testing, the non-radiological, maybe a biopsy or whatever, that's going to be zero, as well as physical therapy. Physical therapy is zero copay for any of the visits. Urgent care. If you go to the urgent care of your network, whether it's Hoag or a different network, that's going to be zero copay. However, if you're out of the area and you need urgent care, then that's going to be $20. Now, one of the things I did want to say to you is that all of the medical benefits within United Healthcare are worldwide. So if you are going to Italy for a nice trip and you get sick, you can be seen, and there would be no cost to you. Now, let's see. Let's talk about the prescription drugs. I'm going to give you two amounts, one for 30 days and the other for 100 days. So Tier 1 and Tier 2 are going to be 0 copay for 30 days and 0 copay for 100 days. And for Tier 3, it's $35 for 30 days and $95 for 100 days. And then the Tier 4 is going to be $100 for 30 days and then $290 for 100 days. And they have a special insulin program now where you pay $35 for specific insulins, and that they will keep you at that rate in the gap. And we all know that insulins are very, very expensive. The other thing, Tier 1 and Tier 2 drugs are covered in the gap. So if you do find yourself with some expensive medications, just rest assured that your Tier 1 and Tier 2 drugs will not cost you anything. Tier 5 is 33%, and they don't have a Tier 6. Now, dental coverage. So you can get up to 3 cleanings a year with the HMO dentist. And now they've also added some comprehensive dental that's, we can have up to $500 for comprehensive dental care. There's also an opportunity to do a PPO buy-up dental, and that's $38 a month for $1,500 worth of benefit. Hearing aids. Hearing aids are $375 to $1,425. And then vision, you get $300 towards frames, and the lenses are included for free, or you can have that $300 towards contact lenses. And the exam is free, is $0. Now, the health club membership is called Renew Active. It's kind of like Silver Sneakers, but it's more of a wellness program. And you can go to most of the gyms around here, and then you can get brain games and all these different things. You can also, they have a program that they will give you money for certain health things that you've taken care of. Like, so maybe you had your mammogram, or you've had your annual physical, et cetera. And so you just let them know, and they'll send you a little gift card. Now, transportation, 24 one-way rides, and that's $0 copay. Chiropractic and acupuncture, you have 20 visits each, and that's $0 copay. Now, they also have the over-the-counter products, and that's $50 a quarter. But if you don't use it, you lose it. So just so you know that. And then the personal emergency response system, you know, the Philips Lifeline, that is $0 copay, as well as the monthly service charge is $0. And podiatry, they have a couple of visits a year that's non-referral, that you can go and have some maintenance done. They have another service, it's called Navigate for Me, which is kind of like a concierge service if you have been maybe you've gotten cancer or some other illness that you need some help, and they kind of facilitate things for you. So one of the things, they do have a special needs plan now for diabetes and heart disease, and also they have Medicare supplement as well as 3 RX plans. So again, my name is Rosalie, and my number is 714-292-3796, and I just want to wish all of you a very, very happy holiday season. And now I'm going to turn it over to Henry.
All right, I'm back. Thank you very much. I just wanted to take the time on behalf of all the presenters to thank you for being here and taking time out of your afternoon to listen to some of the updates on Medicare and all the health plan updates and benefits. We just want to let you know that we really appreciate it, and it's a lot of information. If you need to find our presentation or the plan benefits, click onto the link on our YouTube. You will see the links below the channel in this area here. But thank you very much. Have a Merry Christmas, a happy holiday. And once again, thank you very much. Be careful. It's really foggy out right now. So thank you. Bye-bye.